Introduction. Hematuria is a condition characterized by blood in the urine. It can be classified into two categories, namely, gross or macroscopic hematuria, where the urine appears discolored, and microscopic hematuria, where blood in the urine is not visible to the naked eye and is only visible under microscopic examination. Further, clinically relevant distinctions can be made between painful and painless hematuria and hematuria of glomerular and postglomerular origin. Causes. The various causes of blood in the urine include kidney infection or pyelonephritis, urinary tract infection, kidney or bladder stones, glomerulonephritis, the inflammation of glomeruli, which are the kidney's filtering units, enlarged prostate as a result of benign prostatic hyperplasia, prostatitis, or aging, kidney injury as a result of an accident or contact sports, cancer of the kidney, bladder, or prostate, inherited disorders such as sickle cell anemia. Signs and symptoms. The common signs and symptoms of hematuria or blood in the urine may include difficulty with urination, pain and burning with urination, pain in the lower back, sides, or groin that often comes and goes, frequent urge to urinate, bleeding, cloudy and foul-smelling urine, fever. Diagnosis. Hematuria or blood in the urine can be diagnosed by one or more of the following. General physical examination. This includes assessment of blood pressure, pulse, prostate in a male, and gynecological organs in a female. Urinalysis. In this test, a urine specimen is collected and checked for microscopic red blood cells, white blood cells, and bacteria. A urinalysis can also check for the presence of crystals, ova, or parasites. Blood tests. These are performed to check your complete blood count, including erythrocyte sedimentation rate, serum urea, creatinine, and electrolytes, along with albumin, calcium, and liver function tests if you are unwell or in renal failure. Pelvic ultrasound, CT scan, flexible cystoscopy. This involves insertion of a lighted long tube with a camera through the urethra to inspect your bladder. Transurethral biopsy. This involves removal of a part of tissue for examination in the lab. Treatment. Treatment typically involves treating the condition causing the hematuria, including taking antibiotics to eliminate a urinary tract infection, shrinking of an enlarged prostate with prescription medications, use of shockwave therapy to break up any kidney or bladder stones, surgical excision of tumors affecting the kidney or bladder. Prevention of hematuria. Hematuria can be prevented by following some healthy practices on a regular basis. Quit or avoid smoking. Limit consumption of excess salt to prevent stone formation. Drink plenty of water daily. Urinate instantly post-sexual intercourse, as this helps cleanse the urethra from harmful bacteria. Summary. Hematuria is a genitourinary disorder characterized by blood in the urine. Other symptoms include abnormal changes in urination, such as pain, a burning sensation, foul smell, or frequent urge to urinate. The condition may seem harmless, but it could be a sign of an underlying disorder that requires medical attention. Visit your nearest specialist to learn more about hematuria and its treatment.